Is people need to take responsibility and understand that it's important for them to be vaccinated. They need to come out to be vaccinated. We have set up very many vaccination centers throughout the country, facilities. Perhaps even this facility can apply to be one of the vaccination centers, and they can be supplied with the vaccines to vaccinate people. We have tried in many ways to reach people through spreading the vaccination facilities across the country, through our own communication strategy, talking on media, with media and other fora to try to get people to come. We have even gone beyond and now are going in outreach. We are trying to reach the people. We're going out to reach the people, and we'll continue to do that, where we can go out into marketplaces, into worship places, and get people to be vaccinated. For some reason, this region, yes, has lagged behind, but I think people just need to be informed. As media, you have a responsibility, a big responsibility too, because you can assist the government by propagating that information, getting it out to people, to tell them the importance of being vaccinated, the safety of the vaccine, the need for them to present themselves and come out and be vaccinated. So the Omicron variant, of course, is spreading very fast throughout the globe. In some countries, it is now the predominant. Even here, we believe that it will if it is not already the predominant variant, it will be. So we will be with Omicron for a while. Omicron's feature, of course, is that it spreads very, very fast. It can be transmitted very easily. But we are seeing also that in terms of illness that it uses in those who become ill and need hospitalization, the rate is lower than what we saw before with the Delta variant, which is a little bit of good news, because but if it spreads fast and we don't prevent its spread, then the numbers will still be high and we could be overwhelmed. And that's why we must have all of these protocols adhered to, plus the vaccination, for us to succeed. I am aware of the CDC reduction of the period of quarantine from 7 to 5 days. And if you watch that carefully, they also mentioned why they did that. One, we have to understand the virus, the particular variant that we have at any moment, and how it spreads. How long is a person able to transmit the virus? That is the key question here. And it's generally considered to be a few days before the symptoms show up, and maybe another 3 or 4 days after the symptoms. Studies have to be done to come up with this kind of information. Once studies have confirmed that this is the way the virus spreads, that after 3 days or so of infection, the chances of a person who is infected transmitting it is low, then you can take measures like this. But we don't have that information. This is work that has been done elsewhere. We're also watching to see how infective a person is after they have been infected. For us, for now, we still remain with our old period of quarantine. But as we move on, of course, we will adjust that as new information arises that gives us the confidence of taking action such as that. Of vaccination, but I know that by yesterday or so, we were probably above the 9.8 million or so. And if people turn out, we still have the chance. We have been vaccinating when at peak times, when we have the most number of people who have come in, we have vaccinated almost close to 200,000 in one day. So if in the next 2 days we can vaccinate 150,000 people within the country each day, we will definitely reach the 800. But we are also at a time of holiday, festive season. People are out there, and the turnout generally is not good during these times of time. But if we don't hit it by the 31st, definitely we will hit it very, very early in January. So we will have achieved that goal. Beyond that, of course, we still need to do more work. The 10 million that we talk about is people who have at least received 1 injection or more. Okay? So they are not all fully vaccinated. Approximately 50% of these would be fully vaccinated, 50% have only one injection and they will need to get a second injection. The key thing here is we need to have people fully vaccinated. So we still have quite a lot of work to get people fully vaccinated. Because people who show up now during this period who have been being vaccinated, they have about four weeks or so between the first and the second injection. They need to present themselves for that second injection. And that time we will be fully vaccinated, and I think that will be a milestone achievement for us. Then we need to go beyond that and get the target of vaccinating actually all our adult population by the end of 2023. So the vaccination campaign is still on, and people need to come out and present themselves for us to achieve these targets.
This particular structure that you're seeing now is a medical hospital that I would say 70% fully equipped. We have a fully fledged lab with a hematology machine, a biochemistry machine, which means the primary health care functions of a hospital, where you have the medical doctors and the clinical officers, the pharmacists, the lab technicians, the nurses. This particular place now, diagnosis can be done, examination of what the patient has, treatment can be conducted, and therefore we can also do the deliveries for the mothers, which was very important. The children can be looked at as well. So we have an ultrasound machine, we have a fully fledged pharmacy, the lab fully equipped. We can look at the kidney function, the liver function tests. So any pregnant mother within the community can be then looked at every trimester, looked at the blood count, the ultrasound, the condition of the baby will be seen easily. The mothers can see the baby clearly. We'll have an automated General Electric ultrasound machine, which is a modern one, will be available in February. We already have one, which is a black and white, but in February we'll have a color G. It's on the way, actually it's just been put on the ship. Which means this community here, which is the Muslims and the non-Muslims, we are happy that Al-Ihsan will be in a position to take care of the ailments of this area, whether it is typhoid, malaria. We have nebulization for this pandemic COVID. It means we're in a situation to be able to screen the patient, to look at the oxygen level, SpO2, to be able to manage the COVID in this particular area. So our mothers, they will deliver here, our children will be treated here, and the normal malaria, typhoid infection will be done. In short, we already have advanced equipment. I would now go to what is the future, what would wish by Allah's blessing and the coordination now between Bungoma, the community, and Nairobi. Where do we want to go to the next stage? This is a level 2 hospital. We will be upgraded to a level 3 hospital by March.
COVID receding and being more manageable, we'll be able to proceed much better, because nowadays everybody's attention is diverted toward COVID, and it's very difficult to allow all the NGOs an opportunity to look at this aspect as well. But hopefully in the first quarter of next year, we'll be able to manage some more. And we have, as a High Commission also, we are trying to contact other philanthropists as well around East Africa, who would be able to help us, and also, if possible, from Pakistan as well. And it is a great honor for me today to come over here, and it has given me an opportunity to see the beautiful landscape all along the way, and also Bungoma. And I hope that this facility, provides the essentials and also is upgraded in near future, the way Dr. Hassan says, to be a full-fledged hospital and provide all the medical facilities that are required by any community, and especially for women and children, which are the most vulnerable segment of the society. And I hope and pray for the best for the endeavors. Thank you.
أصحاب الجنة هم الفائزون. لو أنزلنا هذا القرآن على جبل لرأيته خاشعا متصدعا
من الشيطان الرجيم. بسم الله الرحمن الرحيم. عبس وتولى أن جاءه الأعمى وما يدريك لعله يزكى أو يذكر فتنفعه الذكرى. أما من استغنى فأنت له تصدى وما عليك ألا يزكى. وأما من جاءك يسعى وهو يخشى فأنت عنه تلهى. كلا إنها تذكرة فمن شاء ذكره في صحف مكرمة مرفوعة مطهرة بأيدي سفرة كرام بررة. قتل الإنسان ما أكفره